COVID-19 has already killed more than 4 million people around the world. As the Delta variant is spreading in every continent, the end is not here yet. It might surprise people to hear that the world's response to this disease has been far faster than any disease in history. Over 1 billion people have been vaccinated, and yet we need to do better. Here's one reason why. This map shows where people have received at least one dose of COVID-19 vaccines. Africa stands out. Only 4% of the population had been vaccinated by mid-August. That's unjust. It's making it hard to stop this pandemic. Each infection can generate new variants that could spread to the entire world. We're in this together, racing to bring the virus under control. We need to get all the health tools out to the entire world. Diagnostics are very key because you can identify who's spreading the disease and change behavior. This diagnostic, the LumiraDx, is amazing. It's an innovation, cheaper, and smaller than the diagnostic devices that came before. Countries can take it out to remote areas and get the results in just 12 minutes. The Foundation, Lumira, and a new group called the African Medical Supplies Platform reserved over 5,000 of these for Africa.
When COVID-19 arrived in Kenya, we had minimum personal protective equipment and medical supplies. The tests available were too expensive, the turnaround time was too long, and notoriously inaccurate. The Lumira diagnostic tool has been a game changer. We can get the patient sample and we can start running the test. And in 12 minutes, we have the patient results. Most importantly, the results are accurate. If we stand a chance of stopping COVID-19, we need the proper tools and trusted data in order to make the best decisions to better protect our communities.
As well as testing people to know who's sick with COVID, we need to actually look at the virus and see if a new variant is emerging. This map shows different COVID-19 variants over time. We need to see that change in variants very quickly. That lets scientists figure out what tools are working and where to focus resources. Today, over 100 countries are collaborating to take that sequencing data and upload it to see the variant trends.
We have been sequencing pathogens for the past 3 years. When COVID-19 hit, we felt like all that sequencing work was a practice to fight this new war. We test by day, sequence by night. It's hard work, requires long hours, but we have to do it to ensure that local data are incorporated into vaccine designs and policy decisions. We analyze every individual virus and then upload all that data into global databases in real time, where we can compare them to other viruses being sequenced all over the world. We are adding both to local and global knowledge.
Around the world, there are very few high-volume vaccine manufacturing facilities. Expanding the geography of vaccine manufacturing, both for pandemics and routine immunization, is a challenging but important task. A few decades ago, India invested in its health capabilities, building research infrastructure in cities like Bangalore, Hyderabad, Chennai, Ahmedabad, and Pune. Today, 2/3 of all the world's children receive a vaccine that was made in India.
Welcome to Pune, where medical manufacturing, IT, academic institutions, and complex industries have turned out great local innovations for the world. To meet vaccine production needs, India invested into physical infrastructure and created an atmosphere for high-volume vaccine manufacturing. India also helped create regulatory groups accredited by the World Health Organization to ensure that the highest quality standards are being met and at scale. Together with partners, India makes sure that the market, the incentives, and the opportunity is there for this industry to thrive.
Some amazing solutions can scale up for the entire world. It's inspiring, and it makes us know we can get past this pandemic and get back on to finishing the SDGs.